So without further ado, we're going to talk about painless injections, balancing the art, science, and business of dentistry. We all want to do beautiful dentistry. All a zirconia crown does is, that's all it does. And that's why biomimetic dentistry is so important. Force distribution. And so when people say, well, I'm going to put them in full mouth zirconia and it's not going to break, well, I'm going to show you some great cases that were done what I thought perfectly. As a matter of fact, Greg, that patient that we saw together, unfortunately, she passed away. That case failed. That case failed. So every patient has a past dental story and you need to understand it. Also, I did sedation in my practice. I don't do it anymore. And I will tell you that I'm totally against nitrous oxide, especially in children. Especially in children. Why? Because what we're teaching that child is that you can have a better life through sensory change. So if you don't know what deaffectation pain is and you don't understand what it is, you need to learn about it because it's part of your armamentarium for treating your patients with kindness. Because I've never met a crazy patient. Actually, I met one crazy patient. She was an airline stewardess that had about 15 facial surgeries. And she goes, if they could just turn my head like this just a little bit, I know I'd be pain-free. Unfortunately, she offed herself, and because no one would listen to her. But I believe in my heart of hearts that she was suffering from deaffectation pain, and I didn't see it at the time. So let's talk about that autonomic nervous system. Sympathetic stimulation, parasympathetic stimulation, pupil dilation, saliva production, mucus, all these things. A box of needles is probably the cheapest thing you can buy in your dental office. So you want to buy a really, really good needle, and it makes a difference. And which way is the bevel? To the outside or the inside? And why is there a dot on that needle? So it shows you which way the bevel is facing. Most everyone doesn't even look at it. They're depositing the anesthetic in the wrong place. All right? And when you're working, sometimes the teeth are difficult to numb. But when you're using the right technique, you can get any tooth numb. So when you're doing your painless injections, you have to talk to your patient. You have to be understanding, not kind, not nice, understanding. You have to be in control, and you have to realize what you want to inject. You never use topical on these, never, ever, 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 ever. But one of the things that works, believe it or not, is fireballs. What's in a fireball? Capsaicin, capsaicin. You can have a patient go and buy some fireballs, put it on the site in an aroma, and they go, oh, it burns. But then the pain goes away. So when you determine that, and the patient has agreed to treatment, you take your mirror and you go, this is going to bother you a little bit. And they sometimes wince or they go, yep, that's where it is. And you push as hard as you can on the area and you introduce maybe a quarter of a carpule of carbocaine. No epinephrine. The higher the concentration, the greater the toxicity. You know how I feel about topical. We want to numb this tooth. Are we going to give a block here? I don't think so. But what we are going to do is we're going to infiltrate that area. Now, what you're looking at there is you're looking at an infiltration that was done in that site without any topical. If you look at the needle and you look at, and if you think these, Greg, if you think these shots were easy to get, they weren't so easy to get. I said to my dental assistant, sit down. Look at where the bevel is. Look at where the anesthetic is. You see the anesthetic squirting to the outside? I don't want it squirting to the outside. And when I'm doing this and I'm holding onto the patient's lip, the needle is positioned beside the lip or beside the tissue. The tissue is being held. The needle does not move. That's parenthetical to what you think. The needle does not move. The tissue moves into the needle. I have my hands on the patient a lot on their face. And the reason I do that is because I want to break the wall of, the way to describe this is, we men, unless you had a mother like Esther Hoos, who was a feminist before Betty Friedan, you must treat people with tremendous respect. You are only going into the most intimate part of someone's body. And I really want you to think about that for a second. You're going into the most intimate part of someone's body. And so you must ask permission before you do anything. May I please?
Yep.
May I please? Would it be okay? Would you allow me to? It's not open your mouth.